Viva Clark County. Welcome to Las Vegas in the 84th Annual NACo Conference and Exposition. I'm Timothy McHugh. I'm the Associate Program Director of Health at NACo. I'm here with several of my staff members and team, Pamela Mann in the back, Kirsty Fontaine, and Joseph Burkhart, who scanned you in, and will be my co-host for the afternoon. We are delighted that experts and thought leaders from across the country have gathered with us this afternoon to help address two issues affecting counties coast to coast: affordable housing crisis and unhealthy homes. Let's look at the reality. Before we get to that, though, disclaimer for legal purposes. Support for this session was provided in part by Robert Wood Johnson Foundation. The views expressed here do not necessarily reflect the views of the foundation. To learn more about the foundation, visit www.rwjf.org. It's also brought to you by the Healthy Counties Initiative and Post, which is now combined in one initiative at NACo, Parks' Open Space and Trails Subcommittee. If you need more information about Healthy Counties, please feel free to check out our website or talk to myself or anyone on the team in the back. So the numbers. According to the NACo Affordable Housing Toolkit, which we'll learn more about this afternoon, in 2016, over one-third of American households were burdened by housing costs. That means paying 30% or more of income on housing. Last year, the Census Bureau reports that 138,537,078 housing units were in the United States. In 2011, the CDC reported that 5.2% of units were identified as, quote, inadequate. The Center for Disease Control defines inadequate housing as an occupied housing unit that has moderate or severe physical problems. For example, deficiencies in plumbing, heating, electricity, hallways, and upkeep. Examples of moderate physical problems in a unit include 2 or more breakdowns of the toilet that lasted 6 months or more, unvented primary heating equipment, or a lack of complete kitchen facilities in the unit. Severe physical problems include a lack of running hot or cold water, lack of a working toilet, and exposed wiring. The CDC also defined unhealthy housing as the presence of any additional characteristics that might negatively affect the health of its occupants, including evidence of rodents, water leaks, peeling paint in homes built before 1978, and an absence of working smoke detector. Even if we use the 5.2% figure from 2011, which we assume has changed since then, that would mean that 7,203,928 housing units today would be inadequate or unhealthy. So, what does that mean? Some of your residents in their own homes are being exposed to asthma triggers, mold, maybe being exposed to lead or asbestos, or living in a home with a risk of fire, or being injured. It means that children miss school, their parents miss work, kids miss opportunity in education, and parents might miss pay, making it even harder to do necessary home repairs. It's a vicious cycle. So, what do you do? Our experts here today are here to help answer that question. Let's look at the agenda that we'll have for the next 2 hours and 45 minutes. First, from Clark County Social Services, we have Michelle Fuller-Hillauer. She'll be presenting Unlocking Doors Through Public-Private Partnerships. Following up is our interactive workshop part of the session, using data to understand the intersection of housing and health, from Joe Hinton from County Health Rankings and Roadmaps, and Shadiko Owusu from Change Lab Solutions will be developing healthy housing policy strategies. Next up, one of our own teammates from NACo, Terrence Muda, will be presenting on the NACo Affordable Housing Toolkit for Counties. And then the second half, we have the role of home builders in the conversation with Carl Eckhart from the National Association of Home Builders. Following that, we have Jonathan Wilson from the National Center for Healthy Housing, presenting the Housing and Health Connection. And then all of our speakers will be joining our panel up front for at least 45 minutes of Q&A with the audience, in our moderator, Michael Scott Davidson from the Las Vegas Review-Journal. And following, we also have 2 other panelists joining us, J.R. Walters from the Samish Indian Nation and Ryan Park from Laserfish. Without further ado, just some mechanics. There is water on the side. We do have a text into conferences staff about adjusting the temperature in the room. We heard some feedback on that. And for housekeeping, if you need the restrooms, they're down the hall and to the left. Because it is almost a 3-hour session, please feel free to come and go as you need and use the restrooms or jump up and stand up and get some water and whatnot. So without further ado, we are going to ask Michelle to come on up for her presentation. Michelle is a social service manager for Homeless Services Coordination for Clark County, Nevada. Her responsibilities include continual collaboration and coordination of service for homeless people and leadership for resource and development efforts to spearhead systematic change. For the last 14 years, she served as the Continuum of Care Coordinator. In addition to being responsible for the yearly process and submission of the HUD-COC Consolidated Application, Continuum of Care, she has served the HMIS lead for the 3 Continue in Nevada and State SOAR implementation lead. Her duties include planning, evaluation, and coordination of services, providers, oversight of the HMIS implementation, inclement weather program, year-round shelter program, offsite lodging, completing the annual homeless census, collaboration with faith-based organizations to provide homeless services, and the coordination of Project Homeless Connect. Michelle, the microphone's yours.
Good afternoon. You like that we turned the temperature down here a little bit for you outside just because you were coming to visit our community. So instead of 120, it's only 110. So I'm glad to be here to talk to you about our public-private partnerships. I'm going to actually hone in on 2 of those public-private partnerships that we have in our community. I'll start with Healthy Living. Healthy Living actually began as a HUD Continuum of Care program. It was 46 beds for folks that were medically fragile and were chronically homeless. So had a long-term history of homelessness, either 12 months or longer, or 4 episodes over a 3-year period, and have a diagnosable disability. We found that at that time, when we implemented the program, we were able to engage our landlords and were able to serve more clients because we had lower rents at that time. That was prior to the last couple of years. So with our rent savings, we determined that in order to serve more clients, more than the 46 clients that we originally had in the program, we needed to bring more dollars to the table in order to provide support services. So we looked at our data and who was accessing the program and who was not able to get into the program because the beds were full. What we found is one of our managed care organizations were providing a lot of referrals to this program, and their clients were having to be denied because we didn't have spaces available. So we engaged in a conversation with that managed care organization and said, we can serve more of your members, but if you can help us by paying for the case management. So they did. They came to the table. We just expanded that program by 16 beds. It was kind of a pilot at that time, but now it has become a longer-term implementation of the program. So now we serve 61 persons in that program. What we found also from our data is that many of the clients that were being denied for Healthy Living was because they were not chronically homeless. And since it was a federally funded COC, Continuum of Care program, they needed to be chronically homeless. So we identified that we needed a program that provided some intense case management services with shorter term rents, or rents for folks that were homeless but not chronically homeless, but they still had a medical fragility. So we worked with our folks that have our low-income housing trust fund dollars and identified that if we could use some of those dollars for the rents, then we could ask that same managed care organization to pay for the case management services. So they were on board. We moved that forward as a pilot, identified that the program was having phenomenal outcomes, and I'll talk to you about outcomes in just a minute. What we have done at this point is the funding source from the Low-Income Housing Trust Fund dollars are not available. However, we recognize that this is a continued need, so we found another funding source to continue with the rents so that we can continue to provide the case management services. Again, using a pilot, identifying where the needs were, and expanding. So let's talk a little bit about the data. For Healthy Living, we serve about 56 clients at any given time. Mostly male are served in the program between 18 and 62 years of age. All of them have at least one disability. 96% of them have 2 or more, and 82% of them have 3 or more disabilities. So these are folks that are really medically fragile, that are chronically homeless. They've been homeless for a long period of time. After being housed through this program and being provided case management services, 73% of those clients remain housed. We've been running this program for 7 years at this point. So we have excellent outcomes. 15% or 15 of the clients have exited the program to self-sufficiency. They had 630-day average length of participation. So this data is actually over a year period from 6/1 of 18 to 5/31 of 19. Of those 15 exits, 2 of them went to permanency, 2 to an institutional setting, unfortunately, 2 to a temporary 7 to a temporary destination, primarily family that were able to take them, and 4 had other exits, 3 of which unfortunately died while they were in our care. So what does this do for the medical costs, medical cost savings? We looked at the data from our managed care organizations 90 days prior to being housed in this program and 90 days after being housed. There was a 100% reduction of acute admits to the hospital. We also looked at the data for 180 days prior to being housed to 180 days and 180 days after being housed, and there was a 75% reduction or almost a 70% reduction in cost for admits. For emergency room visits, again, 90 days prior, 90 days after, we had a 25% decrease in emergency room admits, and there was an increase in the cost. There's kind of the stabilization period for folks that 90 days. They're still using emergency room as their primary care, so while the case managers are trying to stabilize those folks and get them connected to a primary care physician. And we see that after 180 days being housed, there's a 50% reduction or a 40% reduction in cost. So let's talk about hospital to home. Hospital to home, as a reminder, is for those folks that are non-chronic, so they're still homeless, and they have a medical fragility. Over the last year, we had 64 clients served in that program, the majority of which are male, again, 18 to 62. And as you can see, disabling conditions, many of them have more than one disabling condition. 63% of those 64 clients in that year have remained housed. We had 24 exits with a 305-day average. 11 of them exited to permanency, 3 to an institutional setting, and then unfortunately we had 5 folks that passed away while they were in program. So let's talk about return on investment. Acute admits, again, 90 days prior, 90 days after being housed, there was a 21.4% reduction in acute admits, saving almost 22%. At the 180-day measurement, we had 65% reduction in acute admits and 65% reduction in cost. And then at a year, a 61% reduction and a 60% reduction in cost. An emergency room utilization, again, we have at the 90-day mark, we had 13% reduction and a 13% reduction in costs. 180 days, 70% reduction and a 70% reduction in costs, and at a year, 52.7%. All this tells us is that what we're doing not only is helping folks that are medically fragile, that don't have a place to live when they leave a hospital, have a secure and safe home so that they can stabilize, but it is saving us money. It's saving our communities money, and it's saving our managed care organizations money. Because of the savings in May of this year, we were able to enter into discussion with that managed care organization and identify that we want to expand the hospital-to-home program. It has good outcomes. It's saving a lot of money for our managed care organizations. So that managed care organization was absolutely willing to come to the table with more monies to pay for case management if we were able to pay for the cost of rent for these clients. So we've expanded that program from 40. We're continuing to pay for those 40 beds. We expanded it to 60 beds, and like I said, the MCO will continue to support by paying the support services. I did neglect to say at the beginning, for both of these programs, we have a nonprofit organization that's actually providing the case management services. So this is truly a three-legged stool. It's government entities paying for the rent, private industry paying for case management, nonprofit providing the service. And we really appreciate the program. We know that it's successful and it's helping folks be housed and have a better sense of life, and they're more safe in their homes. And we know that this is something that is successful and we want to expand upon. So with that.
We're going to save all the questions for the last part of the panel conversation, so please jot down your notes for your questions for our speakers. Next up, I'm going to introduce our two next speakers at once, so I don't have to come up here twice. But first up, we have Joe Hinton, is from County Rankings and Roadmaps, and then he's an action learning coach. Following that, we have from Change Lab Solutions, Senior Vice President of Innovation and Impact, Shaniqua Owusu. Joe's role is to provide strategic guidance to communities who wish to put the county health rankings into action to improve health and advance equity. He's part of a team that develops online tools to connect communities to evidence-informed strategies and community change resources, fosters peer learning and connections, delivers knowledge and skill-building sessions, and recognizes and celebrates health improvement. Joe has over 10 years of experience in education, curriculum development, adult education, and virtual and non-virtual community development. Prior to joining CHR&R, Joe served as an assistant professor of geography and department co-chairperson for the Social and Applied Sciences Department at Harold Washington College, one of City Colleges of Chicago. Previously, before that, he served the state of Illinois, Morton College, and the Center for Economic Progress and Curriculum Development, grant management, and program management capacities. He has a personal and professional interest in how rural and urban spaces can be intentionally designed through an equity lens. Following Joe, Shaniqua Owusu is Senior VP of Innovation and Impact at Change Lab Solutions. There, she works at the intersection of community development and health. She leads a multidisciplinary team that supports localities and organizations across the U.S. and helps them create healthier communities. Prior, Shaniqua worked at the New York Academy of Medicine. There, she was the Director of Strategic Partnerships and Community Engagement. In that capacity, she led community development and participatory planning initiatives and oversaw government relations. In addition, Shaniqua worked for SEEDCO, a national community economic development corporation, where she focused on advocating for support for small businesses, workers, and families. Shaniqua also served as legislative policy analyst for New York City Council, where she co-led the development of large-scale policy and legislative initiatives. Shaniqua and Joe, take it away.
So I only get to pretend to be Joe. I won't be Shaniqua at the same time. But she'll follow me in just a little bit, and I'm sure she's going to outshine me because I just met her today, and I love her energy, and I'm sure you are too. So thank you for letting me be here for a portion of your session today. As Timothy said, I am an action learning coach with the County Health Rankings and Roadmaps program, which is a joint program between the University of Wisconsin and the Robert Wood Johnson Foundation. The idea that I'm going to be talking about today is how we can use data as a central idea to think about this intersection between housing and health. And I have to say, to follow Michelle and to see an excellent local example that really centers housing as a piece of a stable life and a higher quality of life, is a really exciting local program to see in action. So the first thing that I just want to tell you a little bit about is the nature of the program that I work with. The County Health Rankings program is a joint venture between the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation. And I liked the commercial at the beginning that this is not necessarily the ideas of the Robert Wood Johnson Foundation, but we'll stay pretty true to script. I'd like to acknowledge two of my colleagues that are in the room with me today. We are a program that is housed at the University of Wisconsin, but we are national in reach. So I have Kitty Jerome in the room with me, and she's based at the University of Wisconsin, and Ali Havrilla, who is in Maryland. And I know that the two of them will be roaming around the room today to interact with you as well. One of the guiding features of the County Health Rankings and Roadmaps program is our model. Maybe you've seen it today, maybe you stopped by our booth and had a little chat with us about it. But the County Health Rankings model that you see on the screen helps us show that where we live makes a difference. Place truly matters. And it matters in how long we live and how well we live. In other words, our quality of life. If you take a look at the graphic there and you start at the bottom, we believe that effective policies and programs, the orange box, can improve a variety of factors that in turn shape the health of communities. Those would be our health factors. We think of the health factors, those pieces that make up the overall health of a community, as being multifaceted. There are the health behaviors, things like tobacco use, alcohol and drug use, access to clinical care or the quality of care that people are receiving, a variety of social and economic factors like our educational attainment, our employment status, our income level, and then the physical environment. And that's really the focus of what we'll be thinking about today, because we know that safe and affordable housing is a piece of what builds healthy lives. I'm going to break down that model a little bit with an example of some of the ways that we see housing interplaying with health in our communities. When we think about a housing trust fund, for example, that's an example of a policy that could be established at the federal, state, county, or city level. The funds that are attributed to a housing trust fund can be used to build and preserve affordable homes, subsidize rental housing, support nonprofit housing developers, and then as a result, communities have greater access to affordable housing. So that shows up in our model down there in the lower right. An affordable home then opens up many doors for people who are living in the community. It provides them more ability to access other necessities like healthy foods, that's our diet and exercise category, access to medical care, and perhaps better educational attainment and transportation to and from work. In other words, we see one piece of that healthy environment lighting up many aspects of what makes a healthy community. Housing being the center root of those factors. I'll tell you a little bit more about the County Health Rankings and Roadmaps program, because I think the thing people know the most about our program is that every year we release a ranking of nearly every county in the United States that tells you about your health factors and your health outcomes. And people pay attention to that ranking. Data catches their attention. We do know that data is important. It reveals the factors that influence health. But it's not just about data. We offer evidence that helps people focus on strategies that will work to improve health in their community. We offer guidance that puts those strategies into action. And we offer stories of real-world experiences that will guide you in your efforts to make informed decisions and make the best choices for your counties. So we're going to spend most of our time talking about data. It's what catches most people's attention. And I'm sure most of you know, and you heard from Michelle's talk, she had data and she had evidence to back up why her program was working. We know that data is a very important spot in providing that snapshot of your community health. And we believe it's the perfect starting point for investigating ways to improve health in your community. So we're going to, in a minute, take a look at some of the key ingredients that we have been highlighting in 2019 via our County Health Rankings release. In particular, we paid a lot of attention in 2019 to reminding ourselves of the differences in start behind and stay behind because of where we live, how much money we make, or the discrimination we face because of who we are. We know from our definition of health equity that achieving health equity means reducing and ultimately eliminating unjust and ultimately avoidable differences in health. The County Health Rankings provides a whole array of data that can help you identify where action is needed in your community to achieve better health and greater equity in your community. So I'm going to spend just a little bit of time giving you a sample of what you might find if you navigate to the County Health Rankings and Roadmaps website, which I invite all of you to do if you never have before, and I'd be glad to talk through with anyone how to analyze their snapshot. So this happens to be on the left in very small font that you're probably struggling to see, as am I, the County Health Snapshot for Clark County, where we're located today. And I told Michelle she can correct me on anything I say about the county that isn't true. It's always good to have a ringer in the audience. So when I'm first looking at the snapshot, and this is just a static view of it, I use a broad overview to try to assess where my county health factors and health outcomes lie. You can see here in Nevada, there are 15 counties, so I had to use my cheat sheet there. Clark County is ranked 8th for health outcomes, and it's ranked 11th for health factors. So that might be a great starting point for you to investigate when you look at your own county's health. When I take a look at other aspects of the snapshot, we provide you some ways to look at which places might need more help and which places might be strong for your county. We provide a comparison to top U.S. performers. We provide a comparison to what's going on in your state. And we provide trend graphs whenever available to show you how that statistic has been behaving over the last few years. This gives you a broad idea of what you might be wanting to pay attention to in your community. What I think is particularly great about the snapshot, and the reason I love working for our program and referring to it all the time, is a lot of our data, you can dive down deep into it to see where discrepancies lie within your community. You can see breakdowns based on race and ethnicity for some statistics. You can take a look at those trend graphs. You can look at all of the data tables to compare yourself to other counties that are similar in demographic status as your county. So it provides a lot of great comparison for you to think about the ways to explore your data. Every year, we also release a state report for the state that you live in. The graphic on the right there is the copy of the state report for Wisconsin. If you visited us in our booth in the event in the exhibit hall this week, you may have picked up your state report. Our state report this year did the deep dive on that relationship between health and housing. It explores the size and nature of health differences by place, race, and ethnicity, and how state and community leaders can take action to create environments where all residents have the opportunity to live their healthiest lives. Specifically, the report this year helped to shine light on those differences in health outcomes within your state based on racial and ethnic groups, differences in health factors based on place and racial and ethnic groups, and what communities can do to create opportunity for all residents. If you do want to get a digital copy of your state report, you can always visit us at our website, countyhealthrankings.org/state reports. I'm going to show you a few graphics that might trigger your interest in what you would find in your state report. I focused everything on Nevada, and I already realized I said it wrong the first time. I have to catch my pronunciation on Nevada. So when we look at our state reports, there's a lot of lovely cartography, and you might have heard that I'm a geography teacher in my past life, so every time I can put something in a graphic like this, I get really excited. So you'll forgive me for nerding out for a few minutes. Every state report shows our health outcomes map, and you can find this on the County Health Rankings website as well. The health outcomes map shows us a county comparison. One thing you will notice is we've got the rankings of the counties up there for health outcomes. We do have a couple of counties in the United States that we don't provide rankings for. And I looked up the two counties that are in the gray shaded area here in Nevada, and they both have populations less than 2,000. So that's a data point that we aren't able to generate. So we don't provide a comparison for that. Health outcomes help us understand how long people live and how healthy people feel. So this is an important grounding to our overall health. We know that health outcomes vary based on where we live and on our racial and ethnic backgrounds. If you go to page 5 of your state report, if you happen to grab one, but I'll point this out, we have some lovely plot graphs that show us breakdowns on particular statistics. This particular statistic is showing us that variation in length and quality of life here in Nevada that is different depending on where you are and based on who you are and what your identity is. So I'll break down a little bit what this graphic is showing us. It's saying that those two arrows at the top, the blue arrow and the yellow arrow, Asian and Hispanic residents of Nevada have health outcomes that are most similar to those living in the healthiest quartile of counties. White and American Indian residents of Nevada, that's the red and green arrows that are on there, have health outcomes that are similar to the least healthy quartile of counties. And black residents of Nevada have health outcomes that are lower than the least healthy county in Nevada. So there's real differences in statistics based on your race and your ethnicity. We also, in our state reports, provide health factors maps. Health is influenced by a range of factors. We know that social and economic factors like connected and supported communities, good schools, stable jobs, safe neighborhoods, they're foundational to achieving long and healthy lives. And so we do see a difference based on location on these statistics as well. We know that housing is one of those base statistics and one of those ideas that is foundational to health and health equity. If housing is unaffordable or unstable, it can either cause poverty or exacerbate it or cause you to stay in poverty longer. So with our focus on health and housing and the session that we're in today focusing on health and housing, we should do a little bit of a deep dive on some statistics that provide us some guidance to this. We have found that when our homes are near high-performing schools and good jobs, it's easier to get a quality education and earn a living wage. When we live near grocery stores where fresh food's available, or close to green spaces and parks, it's eating healthy and being active is easier. When things like lead, mold, smoke, other toxins are in our homes, they make us sick. It's clear that housing is central to people's opportunities for living long and well. So at that intersection of poverty and housing, we've investigated this as well this year. The 2019 health rankings told us that the relationship between housing and children in poverty is strong. And we want to shed light on the fact that these issues are made more difficult when family budgets are the tightest. In Nevada alone, more than 120,000 children live in poverty. That's 19% of Nevada's children. Over half of Nevada's children in poverty are living in a house that spends more than 50% of its income on housing costs. That leaves very little left over for other essentials like healthy food, transportation, and medical care. One of the data measures that I'm talking about here that's listed on our county snapshot is severe housing cost burden. That's the percentage of households in a community that spend 50% or more of their household income on housing. County Health Rankings and Roadmaps includes this measure in the data snapshot, but as you dive into your NACo housing toolkit, you'll see the use of housing cost burden. That's the number of residents that spend more than 30% of their income on housing costs alone. Regardless of the measure that you select to analyze in your community, there's a strong and growing evidence that stable and affordable housing is linked to health. As housing costs outpace local incomes, households struggle to acquire and maintain adequate shelter and face difficult trade-offs in meeting other basic needs. So this is, once again, from the Nevada State Report, so it's a graphic that I grabbed out of that report. In Nevada, 16% of households spend more than half of their income on housing costs, compared to 11% nationally. So this is something that's specific to the state that we're in. There's those statistics available for all of the states in the United States, and you can see that specific data point for your county as well at our website. Across Nevada, counties range from, severe housing cost burden, from 5% to 17% of households. Nationally, the range is actually much higher than this. We see in some counties 35%, 40%, sometimes 50% of households spending half their income on housing. What this means, though, to us is that even in the healthiest counties, there's people that are living at the margins if this much of their household income is going towards housing. Severe housing cost burden ranges from 12 to 27% among households headed by different racial and ethnic groups in Nevada. We see that black households, that's the upper orangish arrow on the top there, experience severe housing cost burdens at nearly 3 times the rate of Asian and white households. I'm going to show you another measure in just a second on rental costs. Black families are more likely to rent a home than own a home. And across the nation, we see that renters are more disproportionately burdened by high housing costs. High housing costs force some families to live in unsafe or overcrowded housing because it's all they can afford. Home ownership has historically been a springboard for families to enter the middle class. Owning a home over time can help build savings for education, for other opportunities important to health and future family wealth. High levels of home ownership are associated with more stable housing and more tightly knit communities. In Nevada, 55% of households own their home, compared to 71% nationally. Home ownership rates among Nevada counties range from 53% to 83% of households. And home ownership rates among racial and ethnic groups in Nevada range from 29% to 62%. Black and Hispanic households are less likely to own their homes than white, Asian, and American Indian households in the state. And a lot of times I look at these statistics and think, man, this is daunting. I can just look at numbers all day, but what am I supposed to do about it? But I think they underline a central theme that I think we're going to get to today. Assessing the data for your county and community, and even collecting your own data through qualitative and quantitative means, provides a firm foundation and understanding for the assets and needs of your community. They help you pay attention to the gaps in your community, and they help you inform yourself and your constituents on where you need to take action. The good news is, when data seems dire, and it sometimes feels dire, what are we supposed to do? Is we can take action to remove obstacles and to improve health outcomes for all of the people in our community. We can address those gaps. We can create more opportunities for everyone. The way forward does include a comprehensive approach that looks across the community and involves residents and pushes for policies that are tailored to your community. Some places to start. I've just got some strategies listed up here because one aspect of the County Health Rankings and Roadmaps program is we have a strategy catalog. It's called What Works for Health that I'll show you in just a second that lets you dive into the ways you can make a difference in your community. Some of the strategies I have featured right here include making communities more inclusive and connected, using strategies like inclusive zoning and youth leadership programs. Facilitating access to resources for low to middle income families they need to secure stable housing, using strategies like housing trust funds and housing choice vouchers. Addressing capital resources needed to create and preserve affordable housing, particularly for low to middle income families. This can be done using strategies like low income housing tax credits or land banks. You can learn more about these strategies and other evidence-informed strategies in our What Works for Health section of our website. This tool will help you find policies and programs that are a good fit for your community's priorities. It answers the question, what can we do in our community? Each strategy has an evidence rating that helps you decide what's appropriate. They give you evidence that says how likely it is to work, because we know that with limited resources, we only want to pursue policies and programs that will work. And they give you a literature summary that highlights what populations have used the strategy, who it will benefit, possible outcomes and costs, implementation resources, examples of people and communities that have done it. I love this resource. It's another place where there's no maps on it, but I still get to nerd out because it tells me so much stuff that I think is exciting. I know in a little bit my colleague Shaniqua, who's going to get up here and do things that are more exciting than I am, is going to help us think about policies and data and how they have application in your communities. A couple of other things I want to highlight, just because I have your attention for a few minutes, and I never give up a microphone, is that the County Health Rankings and Roadmaps website also provides guidance. One of the new guidance tools that we have are called action learning guides. Timothy previewed that I spend a lot of time working in the virtual space, working with communities who don't have the resources to come to conferences or don't have the ability to do some deep dive training where they can send all of their staff to different events. So we're trying to move more and more of our resources of how to move from data to action into the virtual environment. The action learning guides that we're offering now, we have 3 of them on our website at this time, but more are to come. They are self-directed. They have specific topic focus. They blend guidance, tools, and activities for hands-on practice and reflection. And right now, especially as you're starting to think about how to try to affect some change in your communities in the arena of health and housing, the Getting Started with Policy Change guide would be an excellent way for you to bring people along on this journey with you, people who didn't get to come to the conference this weekend to start to think in this arena. So I hope you'll point some people to those resources. I'm also really excited to tell you about one of the big reasons I'm here this weekend. The County Health Rankings and Roadmaps program and NACo are really excited that we're going to be able to offer a year-long learning event in conjunction with each other for the 3rd annual Rural Impact County Challenge Action Learning Cohort. If that's not a mouthful, I don't know what it is. That's why we call it the RIC cohort, as you might guess. So this year's cohort is going to help advance county efforts to expand affordable housing and understand the link between housing, health, and equity. Selected teams will get to join together as community of learners in a structured format to collaborate, network, and learn together. Teams will receive individual and group-based support from CHR&R staff, that would be my group, to help accelerate learning and action in your communities. If you go to the NACo website at www.naco.org, which I know you're all familiar with, applications are now, and I mean now open. This is something for your community to consider to spend time thinking with learners from around the country on this particular topic. The application deadline for this is Wednesday, August 7th, so the turnaround is pretty quick. We want to get started with our learning and start working together. We are going to have in-person and virtual meetings for this cohort. We are all planning to get together once again at the NACo Rural Action Caucus Symposium in Lake Placid, New York on October 10th. And it will go from there's be a virtual kickoff in September, and it'll wrap up in August of 2020. So we're really planning a full year of activities together to deepen our understanding and move to action on how to affect positive change where health and housing intersect. So I'm really excited about all the work that we're going to do together. My 2 colleagues that I pointed out, Kitty and Allie, are going to be available to talk to you about this opportunity and a couple of other opportunities that I'm going to share with you today. So if you have questions or interest in that program, please check in with us. We're really excited to make sure as many teams as possible get to join us. As I wrap up my time with you and hand it off to Shaniqua for her time, I just want to share a few key takeaways and a couple of call to action. We know that families are experiencing housing cost burden and have little remaining to spend on other healthy options. This is a central idea to why we think housing is something to pay attention to. We can take action to remove those obstacles and create more opportunities for everyone in our community. And that's why we want those action learning guides and these cohort learning opportunities to really click for as many communities as possible. So my last thing before I hand it off to my colleague is those few calls to action I have for you. The second bullet point right there, I already gave you a preview of that. The NACo Rural Impact County Challenge Cohort. The applications are open now, so make sure you check in with us about that before you go. We are also offering, through County Health Rankings and Roadmaps, a two convening Rural Economic Development Peer Learning Series. These are our open call opportunity for anyone around the United States to participate in sharing their experience with rural economic development, to come together on that common topic, and to share challenges and successes that your community has had on that topic. So we think it's a nice opportunity to think about how rural economic development and health are also connected to one another. The final thing that I have listed down there, and I put it in a red box because, like I said, I don't like to give up a microphone, is that we have another cohort called the Appalachian Communities Addressing Opioid Abuse cohort. And I put a red box around it because we're trying to get as many communities in Appalachia to participate in this as possible. We know that the opioid crisis has hit lots of communities really hard, but in particular, we're focusing on that region. So if you are from an Appalachian county, or if you have a colleague or a connection in your network who's from an Appalachian county that would like to participate in a learning opportunity with us on how to address the opioid crisis, we would love to talk to you about that today as well. In fact, today is the best day to talk to us about that. So without further ado, I will say thank you, and I would like to enjoy Shaniqua coming up, and I'll give the stage over to her. And thanks for your time.
Hi, everybody. I don't know about you, but I had a delicious lunch, and it's hot. And I have to say, I'm a little tired. I bet some of you can resonate with that. So with that, I think we should have a bit of a stretch break. So if everyone can stand up. Yeah, reach for the sky. Ugh. Nice. And then maybe get your legs going, like stump out injustice or something. And if you haven't said hi to your neighbor, I strongly encourage you to do so because we're going to do an activity. Nice. I hear a buzz. That tells me people are awake and ready to go, and that makes me excited. All right, so I'm going to spend about roughly 10 minutes talking at you because I really want you to talk to each other. It's a great pleasure to be with all of you today. As Joe has said, and Timothy, my name is Shaniqua Wusu. I'm with Change Lab Solutions. What I'd like to do first is tell you a little bit about who we are. We are dedicated to healthy communities for all through equitable laws and policies. We are a law and policy shop based in Oakland, California that works nationally. We support local and state government as well as community-based organizations and national organizations thinking about promoting health in their communities across a wide range of issues. Here's a little bit about what we do, but in short, we partner with communities. We know that there isn't a one-size-fits-all approach. We provide strategic technical assistance, so you may have a very specific question about how would I implement a shared use policy in my community? I really would like the church and the school to work together and open up their playgrounds. How do we make that happen? We offer an extensive resource library, so we have over 400 tool guides and resources and model policies, which is a tool that we're best known for. So oftentimes, a community may want to pass, let's say, a healthy kids meal, or a sugar-sweetened beverage tax, or implement a new comprehensive plan. We provide those supports. So they are legally based. legally sound and evidence-based. And I should have also said from the outset, we are funded by the Robert Wood Johnson Foundation. So thank you for the plug. I don't have to go through the disclaimer. But also we are funded by the CDC. So many tools and resources you may see come out of there, or other federal agencies are often, their tools are promulgated by us. We also very much believe in engaging with partners to tailor trainings, and again, we can design customized tools. So I'm going to spend some time talking about the pillars of housing policy, and let's face it, it's a pretty daunting task. It's quite varied and wide. You're thinking about programs, you're thinking about actually building the thing. You have homelessness involved. There's a lot. Housing quality and affordability also go hand in hand. So you want to think about preserving what you have, that's existing affordable housing, production of new supply. You want to protect against displacement and poor housing conditions, and promote access to homes on the private market. But what I'm going to do right now is talk to you about comprehensive approaches, which you heard Joe allude to earlier. And this would include creating new and preserving existing affordable housing through policies such as land banks, housing trust, linkage fees, tax credits, and things of the like. Reducing barriers to building new affordable housing through policies that streamline permitting processes for affordable housing. So I think you'll hear from others on the panel today, and a bit of this was permeated in Michelle's presentation of how you need folks to work together, both inside and outside of government. Helping households access and afford private market homes through policies that subsidize mortgages, provide housing education and counseling, reducing energy use and cost, and enforce fair housing laws. And then you want to think about protecting your renters against displacement and poor housing conditions through policies that stabilize rents, establish strong eviction and foreclosure protections, extend access to capital for owners of unsubsidized affordable housing, rental properties. You want to think about abate-led and rehabilitating unsafe homes. And then finally, you want to link complementary policies together, such as with education and healthcare, social service delivery, transportation, and the environment, to housing efforts to ensure that residents have access to well-rounded community resources. So that's a lot. That's like a big mouthful that I just said, and it's like, oh, how am I supposed to do all of this? Or, yeah, duh, how do I make that happen, right? Well, there are hundreds of policies that can improve people's access to safe, stable, affordable homes, but each policy platform has to be tailored to the market context and the needs for the population. A resource point that I do want to highlight is localhousingsolutions.org, which has a whole array of different strategies that are complementary to some of the ones that Joe highlighted and others that you will hear today. And then I also want to touch on a reality. Many of you are representatives of counties, county administration, county executives. And one of the things that we understand is that a brilliant comprehensive policy platform with every best market model out there will collapse under the weight of public scrutiny. And so in many ways, the first step is not understanding which policies you put forth, but how to rally support for a comprehensive approach. And so I think this is probably not new news to most of you in the room, but political will can be a bottleneck to healthy housing. And despite having that menu of policy strategies, it can be a challenge to build that will and to adopt the approach. So here's just some things to keep in mind. For the most part in our country, when we think about housing, we think about the role of the individual. There's a lot of individualism that infuses perspective. So for example, natural segregation. So efforts that you might want to employ to create racial and economic integration, some may not think it's necessary because people want to live in communities comprised of people similar to themselves. That is a held belief by some. Facts don't fit the frame. So you heard from Joe quite a bit about data. But new data presented does not align with a person's existing understanding or anecdotal experiences relating to housing. And often, this causes a person to disbelieve or challenge the data rather than adjusting their opinions. Or the idea of separate fates. Issues like housing insecurity and sacrifices made to maintain housing are simply the result of unfortunate circumstances. Or self-makedness. People are self-made and have agency. Therefore, housing is a consumer choice, and people who are not satisfied with their home or neighborhood should move. If they cannot afford to move, it is because they have not worked hard enough. So these are just sometimes some held perceptions, and this is what you're going up against sometimes when you're trying to move an agenda forward to address affordable housing. And it's just something to be aware of, and I wanted to name it. And therefore, partnerships are key. So what I'm going to do right now is talk about a few organizational assets of organizational partners. You heard from Michelle about the three-party public-private partnership they have going for their housing program. But here are some of the things that partners can offer to you. And let's also keep in mind that government can't always do it alone. So sometimes there's that technical support, so like the county health rankings, NACo, or Change Lab Solutions can provide that. Similarly, you may have groups like that on the ground in your community. Developers, they have land, they have access to financing. Sometimes it's about staff capacity, data, brand value and reach, funding. Sometimes that partner that you want to have at your super table may not be incredibly evident, or you wouldn't necessarily connect them to housing. So one that comes to mind that often is in many communities is your local place of worship or your United Way, which often is an intermediary of money that comes down to communities. Grant writing capacities. I can think of a time when I was providing support to counties in upstate New York, and they were having challenges in applying for grants from the federal government that would have supported their affordable housing priorities, but they just didn't have the capacity on staff to get that done. Also, cultural humility and understanding when you're thinking about different populations, and also the geography. Provision of unique services. So I'm going to keep picking on leveraging Michelle's example of what's going on here in the MCO and how the nonprofit involved is providing the actual service delivery and how important that is. Sometimes neutral meeting space is important. And then I don't want to leave out government and elected official relationships and agencies working together. And then also you have the administration side, and then you have the elected officials, and how that all goes hand in hand. With something like housing, you need everyone at the table, is the point. So I'm going to stop talking for now, and it's time to break for an activity, and I think I have some helpers running around here, and I'm going to set us up of what we're going to do. First and foremost, choose a partner. And then there's 4 steps. And the idea here is to utilize some of the things that you've already heard today. You want to think about a data set. Maybe you already know one that's impacting your own community, but there's some prompts on the worksheet that you're going to receive, and also some tools and resources. You want to think about the goal for your county. Maybe it's I'm going to make up something. Subsidize housing because there's a high percentage of homelessness in your community, and that homelessness is being driven by, could be lack of access to mental health services. Just making that up. You want to identify a policy solution that you think that will help you get closer to your goal. And then identify partners that you would want to bring to the table, whether they're inside of government or outside of government. Does that make sense to everybody? Okay. So as I stated, there are some prompts and examples on the worksheet, but you very much could use ideas and strategies that you may be already thinking about, or a data point that you already know. Some of you may have access to your smartphones and can look up an exact data point using county health rankings and roadmaps in your state, in your county. We're going to take about 15, 20 minutes to do the exercise. Many of us will be walking around to provide support. Then I'll be calling on some of you to talk a little bit about how this resonated with you, what's going on in your county, and then we'll close and wrap. So I should hear talking soon. Excuse me, everyone. I just want to call your attention to the tools and resources just so you know they're there and how you could use them for this exercise. One, there's a key findings report near you. Page 12 has a whole list of strategies. And also on pages 14 and 15 are a whole slew full of indicators. Also, what you might find near you is the Affordable Housing Toolkit from NACo, which also has a whole slew full of policy levers as well as strategies. So if you find yourself stuck or, man, I'd like to look at something, just know that they're around you. Thanks. Hi, everybody, I'm back. And if I'm back, it means we have to come to a close on our conversations. Okay, so our next step and what we're going to do is to do a little reporting out from the exercise. I'm sure there are things that resonated with you. I will be shocked if any of you have a grand plan in 15 minutes, but maybe you do. So with that, would anybody like to volunteer? I promise I won't come call on you, but I might if no one volunteers. Nice. Saved by the bell, everyone.
The first one is always the first fool,
Yeah.
right?
Also, if you could give us your name and which county you're from, that would be awesome.
Sure. Dick Fosbury, Blaine County, Idaho. And I'm working with Jennifer from
Mono County, California.
Mono County, California. And so between us, our data point is that we have currently we have a waiting list for 120 units of affordable housing, which includes low income and middle income, both. And our goal is to develop 150 units in 5 years, because the demand never goes away. Because we know that there's also fatigue when people get on a list behind 120 other people, they just give up and they don't even sign up. Now, on the solutions, we looked at a couple of different things that we're working on, because out in the county, our states, respectively, have requirements for environmental concerns on sewer and water. Typically, we cannot do high-density housing in the county unless we can satisfy the sewer requirements. And so that's been an obstacle because the state controls that, and they have not approved package plants yet for more than one septic tank per acre. So that's a barrier. And so the other things that we were looking at is streamlining our zoning ordinances to enable for higher density, making it easier to develop, and also looking at ADUs and enabling more of them in the county outside of the cities. Most of our higher development, of course, happen in the cities where they have central sewer and water. Our partners that we are looking at and talking about is collaboration with the cities to potentially provide services on sewer and water to enable development. And then the other partners would typically be the developers on streamlining ordinances to stimulate more housing and work with them on what the barriers are, the obstacles are within our current ordinances that make it too expensive to develop or take too much time to develop. Respectively, California is much more restrictive than Idaho is, but we have our own barriers as well, and so that's what we were looking at for housing strategy.
Good job. Yes, while we identify our next one, I just want to provide a comment about that and uplift a culture of health community, which is probably recognized in the County Health Rankings website. It's called 24-1, and they're in Missouri. And the reason why I'm uplifting them is because of something you said around bringing the cities together to basically pool resources. 24 municipalities came together to do that, and they call themselves now the 24-1. The convener of all of that is actually a community development organization called Beyond Housing. And it was housing that drove a lot of it. And to give some folks some context of location, that area is not too far outside of Ferguson. So I would really check out that story on County Health Rankings. That might help you out. Timothy, do we have another? Yay.
So, my name is Lisa Janicki, Skagit County, Washington, so agricultural county north of Seattle. And my partner is Commissioner Helen Price Johnson from Island County, our neighboring county. And we both came up with a solution, actually prompted from the key findings report of surplusing county-owned property or utilizing county-owned property within the city for housing. And so the goal for Skagit County is to increase the number of affordable housing units by 500 units a year for the next 5 years. We're already in a deficit of 1,700 units. So, and the county owns a fairgrounds within the city that's 18 acres, and developers have said that, that produces quite a bit of mixed affordability. So the goal would be to coordinate with the city to establish a sub-area plan to make it clear that that was for housing development, and then to surplus the property once that sub-area plan is in place. And then Commissioner Helen Price Johnson had the great idea of using our rural economic development funds to reserve those to help extend the sewer to the properties that are in the city, because those can be used for workforce housing. So that's our plan. And I know there's one other person here from Skagit County who might go back and rat me out. That particular project, the partner that would be the most important are teenagers who are the FFA and 4-Hers who use those Skagit County fairgrounds almost year round and have a very emotional attachment to all the paint that's holding up the boards on those buildings. And so that will be my number one challenge. So
What happens in this session stays in this session, so you're safe.
The thing I will say about that, maybe to consider, if you decide to really move forward. So I'm glad that this exercise helped, have an idea of, oh, that's really great. That's exciting. High five, Joe and team. Yay. But what you may want to consider is an engagement. Engaging those youth, and thinking about a participatory engagement for what is to come. And, thinking about some preservation, tactics, and pulling in some placemaking and thinking about it from like an art and culture perspective, so that you can hold what's sacred to the young people there, but only they can tell you what that is. And then that might help with the buy-in. I look forward to hearing how it all shakes out, though. Okay, so our time has come to a close. I just want to point you to a couple of other things. I highlighted 2 big resources in the room. You're going to hear quite a bit about the toolkit from NACo in a second. As I said, Change Lab Solutions, we produce all kinds of tools and resources. We have our Health and Housing Starter Kit, which goes through how to develop partnerships, to financing, thinking about healthcare systems, if you're fortunate enough to have one in your area that can do some financing, to the service delivery, the role of public housing authorities, your local public health department, which is an important player, particularly when you're thinking about healthy housing and housing quality. I could keep going. And then our other tool, Preserving, Protecting, and Expanding Affordable Housing, is another great one. We highlight proactive rental inspection and a whole host of different interventions. I encourage you to visit our website. We have quite a bit on a lot of things. And with that, thank you very much.
Thank you, Shaniqua. Thank you, Joe. Up next, we're going to highlight ways that NACo can help you access data. We'll have the Director of Research and Data Analysis for NACo's County Futures Lab, Tyrion Zamuda. She leads the effort to promote NACo as a thought leader on top county issues and grounds the lab's policy in high-quality data. While developing applicable research studies and reports, Tyrion oversees quantitative and qualitative research within the lab. She produces economic analysis of counties and leads collaborations with NACo's data-driven initiatives. Tyrion comes from NACo with more than a decade of association experience, previously working at the Consumer Technology Association and American Staffing Association, and expertise from the perspective of a research firm, Arvino Institute. Tyrion, take it away.
Wonderful. Thank you so much for having me here today. As Joe mentioned, I'm with NACo and do work in the county's Futures Lab. And in the county's Futures Lab, we really focus our efforts on identifying key county issues and providing data and support and analysis to produce reports and recommendations for our county leaders to address and combat issues, find solutions, and also learn from one another. What I'm going to talk about today with you is some of our data that kind of lays out and provides the groundwork of the affordable housing issue, which I know you've kind of covered already today, but then also talk through some case studies or some examples of solutions in some of these areas that we've all been discussing, that we've identified. So you see here, it's no secret to you that the cost burden of housing is an issue across the country. 34% of homeowners with a mortgage are cost burden. Cost burden is spending more than 30% of your household income on monthly housing costs. So We at NACo, we have a tool called the County Explorer, and it's where we map a lot of a lot of publicly available and private sector data on the county level. Up here you see an example of a map that we have put together for cost burden owners. I encourage all of you to check out the tool if you haven't already, but this is just one issue area that we focus on and one area of data that we provide to support some of your efforts as county leaders. So we talked a little bit about homeowners and the cost burden on homeowners. One issue to highlight is also cost burden renters. From 2010 to 2016, the number of cost burden renters has increased by 13%. So this is certainly an issue that as I've traveled around and talked with county leaders throughout the country, have heard a lot about as new developments are going in. New rental units are going in, really identifying areas of opportunity to make those to allocate space for affordable units as well. I was just in Florida speaking on this, and it certainly is the renter issue is certainly, and the homeowner issue is a priority, but the renter issue is kind of rising to the top of what counties in Florida are addressing. So again, this is a map that we have on total percent cost burden renters. If you do visit County Explorer, you can hover over or click into your county, and it will provide all these statistics on housing affordability for your specific county. So we know that this issue it runs the gamut of, first of all, what impacts affordable housing, and then also what availability of affordable housing, the impacts that it has on our communities. Transportation and commute time is just one of them. And this, you're talking about job markets and people getting to their places of employment, as well as infrastructure and transportation in place. So between 1990 and 2016, the average commute time in the U.S. increased by 17%. So we are seeing that increase in commute time from people getting from their homes to their place of employment. Okay. Okay, I think I'm missing a couple of my slides here, but I want to talk a little bit about solutions. So we've talked about interjurisdictional partnerships, and we have in our recent report that was just that Joe touched on, our affordable housing toolkit. We identified some specific programs in counties that have addressed this affordable housing issue, and specifically in interjurisdictional partnerships. So Snohomish County, Washington, conducted a feasibility study of interjurisdictional affordable housing programs in 2009. Then the study then outlined the proper conditions for creating an interjurisdictional program, including a critical mass of jurisdictions that agreed to the partnership, sufficient funding, identification of a host agency to administer the program, and an agreement on how the program would be governed. So that was in 2009, and then in 2013, an interlocal agreement established the county's Alliance for Housing Affordability with the support of the county. So 12 cities and the Housing Authority of Snohomish County. So it's just one example of crossing jurisdictions to really identify solutions, putting in the time. I mean, you see from 2009 to 2013, it's not an immediate solution, but they certainly put in the research and then were able to identify some solutions. So another example is partnering at different levels of county governance. So King County, Washington has done a lot in the space of affordable housing. I don't know if anyone here is from King County. Yes? Oh, great. Wonderful. I'm going to talk a little bit about your efforts. But so King County is part of multiple alliances to create more affordable housing options for residents. The Puget Sound Regional Council is a regional planning body with representatives from over 75 jurisdictions. So the regional plan developed by the council is used by another organization actually established by the interlocal government agreement between 39 governments, the Growth Management Planning Council, to develop countywide planning policies. So again, another example of coming together different levels of government. And in 2017, the county spearheaded the creation of the Regional Affordable Housing Task Force, led by 6 county and 6 city officials. So I hope I got that all right. But all right. And of course, we all know that funding and financing is a very big challenge when approaching this issue. So certainly, fees and taxes can help support that. I know there's a lot of work around housing trust funds, but some examples of fees I think that were already mentioned today too were commercial linkage fees, developer impact fees, demolition fees. One kind of rising area is fees on short-term rentals, hotel motel taxes, sales and property taxes. Hennepin County, Minnesota, recently used the property tax levy in a housing and redevelopment authority. So use that funding source, the property tax levy. All of these examples too can be found in this affordable housing toolkit that you can get on our website, and also we have copies here at the Resource Center. And lastly, I'll talk a little bit about planning and zoning. Grand County, Utah is a great example and resource for some planning and zoning initiatives using high-density housing overlay districts. So always kind of thinking about designating areas for medium density where developers can build very densities, townhomes, duplexes. Just overall, I mean, as you all are very aware, increasing the stock certainly helps decrease costs. And so overlaying zones you can designate specific areas for affordable housing and higher density housing. I know ADUs were also mentioned. We're seeing a lot in the space of changing regulations around ADUs. So I just wanted to provide you a little bit of, again, our data, some context around the issue, and then some solutions that we are seeing from our perspective. So please feel free to reach out to me following this. I work in the county's Futures Lab at NACo, and also, I encourage you to come check out our tool, the County Explorer tool, where, we talk about the breadth of this issue. We have data to support all issue areas that kind of go along with the affordable housing efforts. So thank you all.
Thank you again, Taryn, for speaking. Up next, we have Jonathan Wilson from the National Coalition of Healthy Homes. Mr. Wilson has worked for NCHH since 1993 and currently serves as the Deputy Director and Chief Financial Officer. He has served as a Program Manager for research, technical assistance, and policy work. Mr. Wilson helped coordinate the evaluation of the HUD Lead Hazard Control Grant Program, the largest and most comprehensive study of lead hazard control and housing ever undertaken in the United States. His current work includes assessment of the effects of energy efficiency on residents' health and methods to protect residents from radon exposure. Mr. Wilson has authored more than 25 peer-reviewed research manuscripts evaluating assessment tools and interventions for healthy housing hazards.
Thank you very much. And just in case you're really worried, just because I'm a researcher, this is not going to be a boring research talk. And I do want to give a shout out. I just realized my county council member is here, Deb Young. Thank you. Yay. So I'm not with the county. I'm with the National Center for Healthy Housing. We're a nonprofit. And so I'm talking about the Housing and Health Connection, and what can say more about health and housing than brownies? All right, I know it's late in the day. I need your attention. So anybody here work for your county in food safety? All right, so good. You're not going to give it away. So Duncan Hines, unlike Betty Crocker, was a real person. He was a salesperson in the 1920s, 30s, and 40s out of Kentucky. And he went around at a point, we have the internet, a major disruptor in our economy, changing the way we do business. Well, in the 1920s and 30s, the major disruptor was automobiles. And so here we have the automobile, and that's how Mr. Duncan Hines got around. And when he was moving around, you'll see at the bottom a place that was Sanders Inn. It had a gas station, it had an inn, and a little restaurant that suddenly became KFC today. While Mr. Hines was going around the country, recognized that, not all the food was that good, because these restaurants were popping up, and there was an issue. And we recognized that sometimes he didn't feel so good after these restaurants. So he kept a little black book, and he started taking notes in all these places he was going on how good the food was. And he started, in his Christmas letters, he'd send it out to people. These are the places I would recommend. He was the Yelp of the day. This is where you guys should go to have a good meal. And in Europe at the time, they had the Michelin guide. Well, his friends said, you know what you should do? You should come up with your own guide. And so what he did was he had Adventures in Good Eating. He self-published it in 1936. And one of the notes he had was, the kitchen is the first place I go. More people will die from hit and miss eating than hit and run driving. And we're talking about the early days of driving. So here we have food safety. If you know anybody in your county that's doing food safety, talk to them about Duncan Hines. And just to close that, why do we have brownies is because after he became the Good Housekeeping seal of approval in a way, and he actually, in his later years, he was a salesperson, started licensing his name to products. And 2 years after his death, Procter & Gamble bought his company, and they started applying it to their brownie and baking mix. So that's how we get Duncan Hines products. Well, as public servants, that was an interesting story, but really the true story behind this and why we have successful food safety or pretty good food safety is because 30 years later, Upton Sinclair wrote The Jungle. And if you happen to have it in your college or wherever, it was actually a socialist manifesto about the horrible things that were going on in our society at the time. This was the early 1900s, and talked about workplace, sexual harassment. It's an incredible read. And out of this, people were reading and reading and reading it. It was fascinating. And where did they come out of all these things that they could have taken action about? Oh my God, we could get sick from our food. It was all about them. And so what happened was that in 1880, almost more than 25 years earlier than the book came out, they had tried to pass the Food Safety Act, and it never went anywhere for 25 years. The book comes out, people realize that they could get sick from their meat, and that year, the Pure Food and Drug Act comes out. The next day, the Food Packing Act comes out. We have our meat safety and our food safety and our drug safety all being passed in a 24-hour period in 1906. And out of that process, we have something in our foods today where the federal government comes up with voluntary standards, and they became organized in the 1990s, but they've been doing it since 1898, even before this act passed, but they formalized it with this act. And they come up with voluntary standards. The state governments passed food safety laws. California had the first one in the 1800s. And local governments come up with additional ordinances, and they do the enforcement. Why do I say all this? It will come around to health and housing. We have a housing crisis right now, and often we talk about the burden on the resident, and it's good. I mean, these are the people we should be most concerned about. But if anybody's read Evicted by Matthew Desmond, an incredible read, everybody should read it. Evicted by Matthew Desmond. It tells a story about people that go through eviction, and you hear now more and more counties talking about the eviction problem. Matthew Desmond now is at Princeton and has an eviction lab. But one of the most important things that I got out of it was actually the stories of the landlords, because they are under-researched. And what we know about the housing crisis is that almost 2/3 of low-income renters live in small buildings, less than 10 units in those buildings. 50% live in 1 to 4 unit buildings. Almost all of those, over 90%, are owned by individuals. They're not owned by nonprofits, they're not owned by the housing authority, they're not owned by investors, they are owned by individuals. And what do we know about these individuals? They're getting in over their heads. These are small rentals, older, they have higher operating costs, and a study was done in Baltimore by a couple of researchers at Johns Hopkins, and what they found was that of these owners, when you look at their financial situation, 5% were stable. They actually had the reserves to be able to deal with a crisis like a lack of somebody moves out and they don't immediately get a tenant, or somebody fails to pay their rent, or the furnace breaks down and they have to replace it. The fact is, 2/3 of these folks were at risk. They were like one rent check away from not being able to pay their bills. And in fact, almost 3/4 of them were spending less than $1,000 a year on operating expenses, and 1/3 were paying nothing. They were not putting anything into the property. This is a problem. 30% of these folks in this study were not salvageable. They are underwater. They were owning renting property, and they were losing money every year. The only way they were being able to be salvaged is they were hoping that the neighborhood would gentrify and they could get out by selling it, and they were not going to be providing good rental system. They were just sucking the property until they could get out. So that is our problem in our country. We have a housing problem. And we have a bigger problem because this housing is making people sick. And I don't have time to go through all of this, but you should know that there's lead problems. We've already heard other people talking about it. There's asthma problems, and I'll talk about this a little bit more. Radon, the number 2 reason why we get lung cancer in this country. 22,000 people a year die from lung cancer that comes from radon. We have fall hazards in our home. And then we have other things going on, such as we have heat waves, 110, 120, and people don't have air conditioning. For many years in the north, we've required that you must have, if you rent, you must have heat between November and April. But in the south, we have not really gotten to that point where air conditioning is required. With the things that are going on with our climate, we need to get there. Dallas passed something a couple of years ago that requires that more and more communities should be doing this. But just to take one slice, asthma. It affects 25 million people in this country, about 8% of our population. About 5% have active asthma, which means that they need medicines or they need some special support from their doctor, and it's costing our country over, or at least $56 billion a year. That's what the CDC says. 10 people die a day of asthma. It's a real problem. And what we know is that 60% of asthma attacks are triggered in part by environmental factors like pests and mold. We have housing-based triggers like dust mites, the pests and the pesticides, moisture which leads to mold, and secondhand smoke. All these things are triggering asthma attacks. We know from our data that 15% of our population smells musty odors. And when you smell musty odors, there's a high likelihood you have mold. And it's not because the people are leaving wet towels around, which is what some landlords like to tell you. No, the mold is there because there's a roof leak or a leak from the basement. There's cockroaches in 17-18% of our rental properties. There's rats or mice in about 10% of our rental properties. There's secondhand smoke that is getting into the building in the unit next door. And, we can say, well, there's nothing you can do about it, but property owners are thinking about smoke-free policies. The federal government changed it so public housing is now going smoke-free. A great success story in this country. So just to talk about one allergen that's triggering this is dust mites, a microscopic thing that's in your bedding. We don't want to talk about it, but it's in there. It's triggered by humidity. If you have more than 60% humidity, and we know in Maryland that that's like all summer, and if you can't keep your air conditioning on long enough so that you can reduce that humidity, you're going to have dust mites growing in your fabrics, especially your pillows and bedding. 80% of homes in a survey done about 15 years ago had detectable levels of dust mites. 46% were associated with causing asthma. About 25% was enough to trigger an asthma attack, and it's concentrated in low-income housing. So, solution. Our organization partnered with the American Public Health Association a couple of years ago, took a document from the CDC that they had not had the resources to update, and created the National Healthy Housing Standard. Think back to food safety. Somebody at the federal government has voluntary standards. This is a document that you can use. It tries to balance your health needs with affordability. We recognize that we can't create a really expensive home. We have to be thoughtful. So this tries to do that. It's a value add. Some people can use the existing code they have in their counties or cities. They can take parts of this. Dallas, a few years ago, took this around their issues with moisture and their issues with air conditioning, and they add it to their codes. Some may use it as an overlay to the International Property Maintenance Code that is put out by our model code, the biggest model code folks in the country, the International Code Council. Or if you're not in a community that likes to have regulations, you can at least push voluntary standards and use this voluntarily. So, what can you do? We've created a tool that can help you go to the site, look at your own codes, see how they stand up against the National Healthy Housing Standard, and think about where you might be able to do improvements. So that's one possibility. So I encourage you to use that and think about it and move forward. So I want to thank you. I know I'm getting the hook. So thank you again, and appreciate all your support. Do you want this back? No? Yes.
Alrighty. Our next speaker is going to be Carl Eckhart. He's with the National Association of Home Builders. Mr. Eckhart is the Vice President of Intergovernmental Affairs at the National Association of Home Builders. He joined the National Association of Home Builders in 2017 and currently serves as the Vice President of Intergovernmental Affairs. Yeah, who wrote this? I guess I did. In this capacity, Eckhart is proud to work with state and local associations and members of the National Association of Home Builders, to ensure a strong real estate market in America. With his work at the association and the National Association of Realtors, Eckhart has over a decade experience in housing advocacy.
All right. Thank you very much, and thank you all for being here today. The NAHB is a federation, so if you think back to your home county, you probably know a home builder or a carpenter or a banker. You join our association at that local level, and then you're automatically a part of the state and the national association. I want to get you to kind of start thinking in terms of housing in a different way. Instead of saying affordable housing, start saying housing affordability. If I say affordable housing, then you think of crap, right? Think of it as terms of housing affordability, and that'll put a little more positive spin the more times you say it. I think that there can be, and we think there can be a broader solution than just 10 units or, getting 2 or 3 people into a building. If we all work together, we can actually solve the broader problem and take everything that everybody's saying today and still have it be where someone can build a home and make that a profession, but also people can live in a home. These websites, especially the first one, Housing for All, if you go to that, and there were books back there that had these, but the website has it all. This is a compendium of solutions that other counties did, so you don't have to be first. And I know that as elected officials, it's kind of risky to be first, so check it out, and you can find some solutions there. I'm here today to kind of get one goal in your mind, and that's to work with your local home builders, with and not against, as much as they might be jerks, and they are. I know, I work for them. I'd encourage you to keep working with them, help them. They know not what they do sometimes, but you can work with them. About 25 to 30% of the cost of a home is regulation, fees, and time. And those are 3 parts that you as elected officials can control. So if we can knock down the amount of money that's involved in that 25 to 30%, then the rest of it that nobody can really control, which is the cost of land and materials, that part of it we really can't fix. But we can fix that first 25 to 30% before there's even a shovel put into the ground. And if we all kind of work together on that, then you can get to the healthy house. A new house is healthier than an old house. That's a fact. Unless it's built by someone who's not one of our members, then it may not be. But more likely than not, the new home is more healthy. It's more resilient. It can survive the storms. It can survive the winters and the summers. It's got better ventilation, got better materials inside of it, no Chinese drywall, no radon. All those things are taken care of in a new home. It's going to make it cost more from the county's perspective, yes, or the city's perspective, yes. But the folks from Blaine County and then California who are here talked about needing 150 units of workforce housing. Maybe you'd trade where the county builds the road for those units. Not a bad trade, right? You build the road instead of the developer, you can have those units, no problem. That's not an unfair trade. That's the kind of thing I'd like you to take back home and start to use. Give you another example. The city of Minneapolis and the entire state of Oregon have just recently changed their laws to allow multifamily on what was originally zoned as single family. Not forcing it, just allowing it. So King County, are you still here? Yeah. That would drive your residents bananas, right? If you tried to do that, you would get unelected. But if you start now, maybe in 10 years you can get those don't take down my bungalow and turn it into a duplex folks to come around. And then you could have more affordable housing in Seattle. So there's ways to get there that are maybe slower, but we can get there. I'll give you one example of using rural land. South Jordan, Utah. Anybody from Utah? Nope. Good. So they took 4,200 acres that was mining land and turned it into 12 villages, each of them about 1,000 to 1,200 units of housing, starting at duplexes and going all the way to big mansions. Put in schools, put in parks, put in hospitals, doubled the size of the town. But they did it on everybody's got about 1/3 of an acre. So they're not big. So you don't have a whole lot of land cost. So it can be affordable. The hard part to get into people's minds, and most of us are from everybody's from the city, I guess, but the bigger growth is going to be in that unincorporated land in your county. So getting folks to think like the septic problem, you can have a smaller lot and you can still survive. You can, but you have to change the mentality of your own constituents. From an urban perspective, Lake County, Illinois, kind of by Chicago, they're in the process still of doing this. they're at about 50 units so far. The city and the county and a nonprofit formed a bank, basically. And the nonprofit gets a revolving loan. And they use that to buy a property that is in need of rehabbing. The builders and developers rehab it and then sell it to an owner. That person buys it just like everybody else using a bank loan. They pay that revolving loan back to the county and the city, and then that starts the process over again. So there is a loss every time. Yes, the county loses money every time this happens. But what do you gain? You gain a proud homeowner who pays taxes, who talks to their neighbors, who cleans their garage, who mows their lawn, who makes the neighborhood look better. And pretty soon you've got 50 new taxpayers who own homes, and then your city can qualify for more grants, and your city wins awards, and then we have housing affordability for everybody. So those are just two examples you'll find on these websites. We want to be a partner. I know there's a lot of bad blood, especially coming into and out of the housing boom and the recession. We're as guilty as everybody, but we want to be a part of the solution, and I think that it can be done. But I'd like you to think in terms of with your comprehensive plans and your use of tax credits. Don't make homes more expensive. You're not hurting the developer. You're hurting the consumer. You're hurting that home owner, that potential buyer. Everything you do that makes a home more expensive hurts that potential home buyer. The developer is going to just sell it and make the money, but whatever you add in there, and give you an example, I've been fighting this year, a lot of cities and counties are banning the use of vinyl siding. Anybody grow up in a house that had siding on it? Right? Well, guess what costs more? Brick. And so if you demand the use of brick instead of siding, poor people can't buy homes. And so your town can get rid of poor people and have homes cost more. That's fine if that's your goal, and some cities have said that is their goal. We're suing them. But if that's not your goal, then don't do things that make the homes cost more. Come back to the builders and say, hey, look, if we do this, what does it add to the cost? And we can figure it out together. If your local builders are not friendly to work with, call me. I'm sometimes friendly to work with, and we can find those solutions. So we want to be a partner with you. We want to make this work, but start to think about this in terms of a broader picture and getting housing affordability to your county and not just affordable housing to some residents of the county. So thank you very much for your time.
We're in the home stretch. I guarantee there's like 30 minutes left of our marathon session. We'll get you down the stairs to receptions and whatnot soon. So as their panelists make our way up to the stage for the Q&A portion of the session, I will introduce our moderator, Michael Scott Davidson. City and county government reporter at the Las Vegas Review-Journal, Mr. Davidson sits through government meetings so his county residents don't have to. Since 2016, his beat has expanded to include Nevada's affordable housing shortage and Las Vegas city government. We are grateful Michael Scott could join us today and look forward to the conversation he has with the panelists as well as your questions. In addition to our previous speakers, we also welcome representatives from Laserfish. We'd like to welcome J.R. Walters, IT Director for the Samish Indian Nation, and Ryan Park, Senior Software Marketing Specialist from Laserfish, to join the panel, and they'll have the technology aspect side of those mentioned earlier. Take it away, guys.
Hi there, everybody. I'm Michael Scott Davidson. Thank you all so much for being here. I'm learning a lot today. This is great for me to just sit down and hear from some experts up here and some possible sources for future articles. So I'll let everyone get seated. The first people I want to talk to on our panel are JR and Ryan, since we didn't get to have you guys up here yet. And JR, I was talking to you earlier, and what you were telling me was that the Samish Indian Nation is actually partnering with Laserfish, and you guys have found a way to use technology and automation in your grant workflow process to secure more funding for affordable housing. And to get new grants that you weren't able to before. I'm oversimplifying that. Please tell me a little bit about what you guys are doing.
So what we did was we had an old paper process that consisted of many levels of approval, and we had to route them between buildings because we're spread out among different sites. It frequently take a considerable amount of time to get that done. Sometimes they would sit on somebody's desk for days before they got around to reviewing it, and it was just a really burdensome process. So we used a product from Laserfiche called Forms. We were able to automatically route a grant approval process to different people within the organization that needed to be able to review it before we actually applied for that grant, to make sure that it fit with our mission and values. That process was streamlined using that workflow from Laserfiche, and it took a process that took about 2 weeks down to about a day. So it's been really beneficial for us in just maintaining the grants that we currently have, getting those processed through, and then seeking new grants and getting them through that as well.
And I believe you told me you're not only being more efficient with this, you're actually keeping better organization of all the papers, that if you have to go back and review something or you miss something, that it's easier for you to make sure that you get things done on time and have more time to work on new grants, correct?
Yes. One of the powerful things about Laserfiche is that it's a document management solution that we can enforce naming conventions, we can require certain metadata is stored on the records, and then we can use that metadata to look it up again later and review it. Great. Michelle, I had a question for you. When we were going over what Clark County here is doing in my own backyard too, since I'm here from Las Vegas, you were talking about the programs that you launched to stabilize people who have health problems, homeless people who have health problems. You talked about some different ways you had to approach getting funding at first to get the program, to show that it was working, to better sell it and get more partnerships and involvement. My question for you is, what tips do you have for people in county government here today on finding either new sources of funding or new uses of existing funding, so that you can expand programs like this or start programs like the ones we've seen here?
I think the key really is to identify what you're currently doing, where your efficiencies are, what your outcomes are. We really like to focus on data-driven decisions or data-driven information, so that when we move forward, we know that we're going to put something forward that's proven to be positive and have a good return on investment, whether that be return on investment on a healthy outcome or a fiscal outcome, right? So with that, I would say identify programs that are doing well, that have good outcomes. Identify where, if there are savings for other systems through those programs, and then engage in the conversation with key decision makers in those other systems on how they can reallocate the dollars they're saving in a different way.
You mentioned one more thing on that, is that obviously if people aren't being re-hospitalized, readmitted to hospitals, there's got to be a lot of savings on that end, right? Healthcare is very expensive. Has that been a key selling point in the program to get buy-in from the county?
That was absolutely a key selling point, not only for our managed care organizations, but the county not only agreed to that, but when I very briefly at the end of my remarks identified that we were doing the expansion of the Healthy Living or the Hospital to Home program. We just had monies set aside by our county commissioners from the marijuana licensing fees, and they approved us to use some of those dollars to pay the rents to expand that program because of the outcomes and the savings to our system.
That's great. We've heard a lot about data here today. A lot of really great resources we've seen up on the screen. Joe, I actually had a question for you. When you were talking about your website, the data that you guys provide, you mentioned this briefly, but I wanted to go a little more in depth on it and hear from you about this. You mentioned there was actually a section where you could see sort of testimonials or the story of people behind the data. And I thought that was really interesting because as a reporter, I work with data a lot. I work with a lot of these resources. But as a journalist, part of my job is to tell stories too. And when we start talking numbers, sometimes even though people are interested in what we're talking about, their eyes start to glaze over if you hit them even with great infographics. showing what those numbers are. So my question is in your organization's mission, how is including people's stories, how has that helped you better accomplish what you're doing, and what is the power of actually showing the people behind those numbers?
Yeah, we think of the stories as really 1/4 of our mission. You know, we have data and we have guidance and we have evidence, and the stories are a big part of what we want people to focus on, because you're right, you get lost in the work that has to be done, the data that has to be assessed, the efforts that may feel nonstop and may feel long-term. But we have examples that we lift up all over the United States of people who are taking the data, putting it to action, sharing how they did that so that other people can learn from the process. So I think it's vital.
When you go out and you try to meet people that represent the numbers that you're showing to show the larger scale issue, how do you guys go out and do that in getting people to participate in sharing their stories so that governments and the public at large knows that real people are being affected?
I have to say, being at events like this, we learn, as people came by our booth this week, people started to share little snippets of their experience. And if you left your card with me, I'm probably going to follow up to find your story out, because it's important to find stories everywhere. We have the Robert Wood Johnson Culture of Health Prize as well. That's one of the major things that goes through our office in Madison. And we learn a lot about stories around the United States from that process as well. So we have the people who win, but we also have the people who apply, and we learn a lot about the process that they've gone through.
That's great. Pardon me here while I organize my notes.
Yeah, no problem.
Jonathan, when we were speaking actually between speakers earlier, you mentioned one thing that you weren't able to get to during your conversation with the audience, but wanted to talk about was actually the Census Bureau. And as we all know, they not only do the decennial census, but there's the American Community Survey, there's the American Housing Survey. There are surveys going out all the time. But you mentioned that you think that there's actually kind of a lack of housing questions and the widespread surveys such as the census or the American Community Survey. Can you tell us a little bit about how you think that could improve and what that could do for governments?
Sure. So I totally, absolutely love county health rankings. I promote it all the time, so thank you. And their housing question has 4 components, and Joe spoke to a couple, the home ownership and the housing cost. But it has 2 others, and they try to get at housing quality. And the thing is, it's called county health rankings. So it has to be at the county level. We have the American Housing Survey that goes in depth about housing things, but it's only done at either the national level or at the giant metro level. It's not done at a county or census tract. And the question that's asked in the American Community Survey, which is the old long form of the census, is do you have a complete bathroom or do you have a complete kitchen? And over the last 30 years, we've made incredible progress in this country, and less than 1% of our housing has either of those problems. We don't have houses in most of our housing. It's a very small portion. But what we know is that, as I spoke about, people get sick from other things other than that. And we need to shine a light on what is it's really going on. Because if we only talk about housing affordability and not housing quality, we are going to be putting people potentially, focusing too much on the price and not enough on the quality. And I know Carl was just talking about that. We need to think about it as a package, and that's what's critical. So if we can take some of the questions that have been validated in the American Housing Survey, such as we know from an analysis we did for the Kellogg Foundation that if you have deteriorated paint that's as big as this piece of paper in your house, it is very well correlated with having very poor health outcomes of the people living there. I'm not saying it's causation. I'm just saying that it's likely the landlord is not maintaining that property well if they have this much deteriorated paint in it. If we can add a couple of questions like that, I think that then county health rankings is going to be so much better. And so I'm going to push for anybody that's hearing, let's push the census to do this.
Shaniqua, I had a question for you. You talked a lot about collaboration between government, between private companies, between nonprofit actors, and the importance of that to provide affordable and safe housing and to have everybody involved in that conversation. I wanted to ask you about how do you think that, there's one more key player there that I'm thinking of, which is the people that need affordable housing, the people that could, are having trouble, they are rent burdened, or perhaps are living somewhere that, could be in better condition. How do you think that we bring those people into the conversation when we're working with, county governments and all our partners to, better, just know what they need better and find solutions?
Can you hear me, everyone? So the people who are going to be most affected by the policy are the people you need to hear from the most. And I think that's something that we can all appreciate in this room. And so when you're planning for like a new development, you want to think about what are the needs of a particular community when you're going through that planning process. By training, I am a planner, and it's a tenet of ours that you do the scope, that you engage community. What are your needs? I should flag that there are a number of different agencies or things that counties do in terms of determining the needs of community that we ought to use. So I am going to go back to data, and that is your community health needs assessment. That is done by your health system or your public health department. You also have needs assessments that are done by a slew of what I will call folks who fall in the community housing and community development space, because the Community Investment Act requires it. So how are we uplifting all of those mandatory data collection opportunities that require you to talk directly to the people? How are we using that information? That's what I would flag. And I do want to re-emphasize and amplify what Jonathan is saying about housing quality and housing affordability. They go hand in hand. And for you to understand what the impacts are for people, you have no choice but to really talk to them. So we've heard about like mold and lead and all of those things. But what about static load and chronic stress that impacts the health of people, but is a direct derivative of not being able to afford your rent or your mortgage? Or if you are a landlord and you have a small property and you're feeling underwater, that's very serious. So I think it's participatory engagement. And the last thing that I'll say, because I want to honor the reality for local government in particular, is that it's time intensive. It costs money. There isn't often capacity to do it. There's will to do it, but it's the how. How do you make that happen in the course of a day and with a lot of competing priorities? And I think some have figured it out for themselves. Some are evolving, and every situation isn't the same. So what you might do for housing, you might do something different for your open space, or like the lady in the back who was talking about engaging maybe the youth of who, or for age participants. What is that going to look like? It looks very different.
So, Darren, I wanted to ask you, when people go home, go back to their counties after this, they're going to have learned a lot of great information, not only about housing, but a lot of different panels. Their brains are going to be overflowing with information. And so I know when I go to a professional conference, I come back and I'm like, I have 50 new ideas of how to do things. That's a lot, right? And sometimes you send yourself in so many directions, you don't get even one accomplished. So my question to you is, no matter what county, what state people are out here representing today, what are one or two questions that they should be asking as soon as they get back to just get the ball rolling on some of these initiatives?
Yeah, that's a great question, and certainly understand the sentiment of kind of being overwhelmed with information and taking a lot of notes here, making a lot of connections. But then when you get home, what do you kind of do? What are the first steps there? So certainly, I would, upon returning home, first thing is take everything that's truly top of mind. So whether it be this issue or another. Just kind of, put it all out there. Start taking action pretty immediately. Ask yourself, what connections can I make here within my county? What kind of private entities can I start engaging with? Start the conversation. Just kind of getting the ball rolling, building off the momentum. The housing affordability issue is certainly one that's in different stages across the nation. So I really think the first thing to ask yourself is, what can I do next, and start having those conversations immediately.
Carl, you mentioned that some of the ways that you thought governments primarily could help cut down on housing costs for developers to build housing that ultimately get passed on to consumers is regulations, time, that sort of thing. There are some things that they're not going to be able to control, the price of materials, how much labor is in the market where they're at right now. So my question to you is that for governments to have these conversations with home builders, with apartment builders, kind of how should they set the stage for that? What questions should they be asking right away to get more of a partnership, more of a collaboration to build housing that people in every income bracket are going to be able to afford?
It's a good question. I think maybe first try and decide where you're going to make your success. We kind of call this problems right now the missing middle. The super wealthy, the rich, they're fine, right? They're always going to be fine. The very, very poor are not fine, but there are a lot of programs to help with that. You take what Michelle does, and they can move from the street and sick to healthy and in a house. That's a great step. And then they join this missing middle. And there you've got, what else can we control? Labor costs, you mentioned. Well, the average age of an electrician in America is 59 years old. And there's nobody coming up, because my generation all got told you got to go to college and you can't become a tradesperson. And then everybody else, I jokingly but truthfully say, got kicked out of the country. And so there's no labor. Counties can work with job training and try and fix the problem there. Slow, but you can do it. Is the county going to get rid of every impact fee? No. But maybe they can lessen some, and they can work on that. Decide maybe, is there a fee structure that can work? One of the biggest problems is time. If the county can agree that, and some counties are doing this, any permit is going to be denied or accepted within 7 days, right? That would be great, because then the builder knows we can move forward or we can't. Those time delays cost money. Homes are built with loans, and the banks want their money back. So I think setting up those conversations where the realistic goals can be met. Can it be 7 days? No, it can't, because we only have one staff person. Okay, 14 days, right? We can find a way. Can the county and the builders set up a trust fund to help pay for roads or for electricity? Can the counties and the cities agree? Maybe the developer doesn't have to build that community benefit, that park or that school or that other entity that adds cost. Maybe that can be left out of the project. What can be, give and take? I think that can be the best way to do it.
All right. Well, thank you for answering my questions. I know we've got an audience full of experts in their own right, so I'd like to turn it over to the audience. If you guys have any questions, just raise your hand. We'll get you a microphone and get your questions answered.
Really big voice, so I don't know if I need this. Hi there, Sheila Rutledge, DuPage County, Illinois, newly elected, new to government even, and I'm intrigued by the idea of tiny house villages, and I've been talking a lot about that in my county, and I'm just wondering if any of you have any experience with that. Downfalls, have you tried it? What worked, what didn't work? I know that there are successful ones across the country, and that's something I'd like to implement in DuPage.
Whoever wants to answer this one, just go ahead.
It's good and bad. Your biggest problem is going to be getting your fellow elected officials to agree to zone for the tiny house, and not have the stigma of another mobile home park or something like that. Most places don't want to zone for that. One good way around that is to make it a veterans project. A lot of our members are doing this on their own or as their charity, building 30, 40 tiny homes, and then homeless vets move in and begin their process.
And so I wanted to work with the sheriff because he's implementing a job training program, but he gets them trained for a job and then lets them out of the county jail and they've got no place to go. And it's kind of a vicious circle.
Perfect.
So really that's where I want to go first. And as far as zoning, I've already talked to the zoning department. He's like, yeah, I got some property for you. So I had zero pushback on this idea with whoever I'm talking to.
Yeah.
But I know it's coming, so that's the...
Those are the biggest two we always face, so yeah.
Thank you. My name is Kathy, and I'm from the King County. 2 comments, tiny houses to this lady. Make sure that you have a variety of housing square footages. Otherwise, you'll get all single ladies over 60, and the one man that lives there will be placing everything, and he'll never have to cook, but he's an unhappy man. So make sure that you have a variety of different housing sizes. We learned that the hard way. Secondly, in our county, we have pre-approved plans. So if you want to build one of these 20 houses or the flip version of them, you can go right on through. And so we want to continue to make that possible. Here's my question. We're dealing now with 10% of the housing projects need to be affordable and multifamily housing. But the game that I'm concerned about is you're saying the builder should have the choice of doing it on-site or remotely. I cannot edit or audit whether they're ever going to build the remote housing, but I do know if it's going to be in the main house. Do you have any research that says the set-aside needs to be on the premises? Thank you.
Is there anybody that would have expertise in this?
I would not.
I'm a retired civil engineer and land surveyor, and have our county has had applications on that. It's pretty simple. You do not give them a C of O, certificate of occupancy, until they deliver the required improvements or post a security bond to develop that, and require that they have the land where they're going to do the whatever your requirements are. So it can be pretty straightforward.
Do you have a question, Jim?
I do have a question, and this may be for Carl, but I'd take an answer from anybody. Reading through the diversifying housing options, smaller lots, smaller homes, all of this is appropriate for development in the cities, but not the county because of requirements for central sewer and water. So how do we get past the environmental considerations required by the state, limiting 1 septic tank per acre in the state of Idaho, unless they do additional studies that that are not overburdensome, but these requirements for higher density units, small units, ADUs, everything still bumps up against the barrier for the land requirements for sewer or a package plant that you may or may not get approval, regardless of how you streamline your zoning ordinances, subdivision ordinances, et cetera. And I'd be happy to talk to you offline as well at any point.
Yeah, I don't have an answer. Maybe that could change. Do you guys study that kind of stuff, or?
Not precisely around like sewage, not that granularly, but we do look into it. So the one thing I didn't say from the outset is that I work with an interdisciplinary team of attorneys and land use folks and public health specialists. So something like this is something that we would research into. We're based in California, and we do a lot of work there with the Office of Planning in the Governor's Office. So my point in raising that is I didn't have enough time in my presentation to talk about the role of the state when you were implementing anything, whether it's preemptive or not, whether you're going to go through home rule, or if there is an opportunity through your environmental review statutes. In California, it's CEQA, in other places it's seeker. So thinking about those chapters and if there's possibility for it's not so much that it's a loophole, but where there might be flexibility. But I imagine what is needed is to look at those particular statutes again in order to accommodate these new types of what I would call innovations. So that's where I would start. But we would need to actually research your very specific question, and could.
I think we have time for one more. I'll find you.
Let me just also suggest something for the affordable housing in the rural areas too, because we just had a couple weeks ago a colleague who put an amendment onto a senior housing bill that we were passing, and I don't think he quite realized what he was doing at the time. And in Howard County, for one short period of time, we were allowed to build cluster housing for a septic area, which became disastrous, which I'm sure if any of you have ever had experience with that, you understand what I mean. So that was outlawed. You can't do that anymore, but you can build a duplex and have one septic system. So you can have two homes at least together attached. So my colleague amended our senior housing bill to allow this out in the rural areas and to cluster those homes, those senior homes, around the duplex with the one septic, a duplex with another septic, a duplex with another septic. And of course, as he's doing that, in the back of my mind, I'm thinking, affordable housing. It's going to come to the rural part of the county. So he's sort of opened the door with senior housing because where I live, senior housing is more acceptable. So I'm hoping that as a result, we'll be able to eventually utilize that amendment that he got passed for affordable housing too. But I have another question for the panel. Howard County, Maryland has an issue with land. It's very, very expensive. We live in between Baltimore and Washington, D.C., literally right on 95. And we're one of the geographically smallest counties in all of Maryland. So builders, when they come, they don't want to build the middle, what was it, the missing middle? They don't want to build the missing middle because the land's too expensive. Which makes it very problematic. We can get affordable housing, some affordable housing built, because we have some programs where we can get tax credits, and right now we're getting quite a bit of affordable housing built all at once. But it's really hard to find anything in that missing middle and to incentivize builders to put that kind of housing in Howard County when land is so expensive. So I was looking through your Creating Housing for All here, and I saw something about actually zoning your land for affordable housing in some way. And I was just wondering, how would you go about doing that? Do you know anybody that has done that? I mean, how do you fix an overlay like that? Do you actually put in that no house can be more than X amount of money? I'm really curious about how we could approach that in Howard County. And do you live in Washington, D.C.? I figured that. Okay. So you know what I'm talking about. I mean, I'm sure you're familiar with Howard County.
Yep. No, I am. I drive through it often. That zoning, it's sort of a political. It's like you're talking about with the senior housing to affordable housing. if you zone it that, then it makes it more palatable to your fellow commissioners, and it can allow, maybe with that, then you have lowered some fee structures, or you've, some sort of incentives to do that workforce housing. We can have our land use folks work with you from Howard County more directly, but basically it's just a semantics so that you can get it passed, and then you can start to. But it's going to be the end game. Yeah, it's going to cost the county a little bit more to help out that missing middle. But politically, if you're saying, "Hey, I'm trying to help the nurses and teachers and firefighters who work in Howard County, live in Howard County," and this zoning allows for that, it can get done a little bit easier. But yeah, you're risking being the place where no one can live and work, much like some resort town in Idaho or Colorado.
Well, we have a lot of luxury apartments there in Howard County. And I think Montgomery County is experiencing much the same.
Yep.
So that's also an issue. I don't know if other jurisdictions are dealing with that, but it's a big deal in our area.
I would look in Brooklyn. They actually, because of their burst of the bubble of the luxury apartments, some of those are now becoming affordable housing because the bubble did indeed burst with that market. So,
But you're talking about Brooklyn, New York. Yeah. So in New York City, though, pretty recently, and I mean in the last couple of years, the city passed an inclusionary zoning measure in order to help to facilitate some of this. And the outcome of that, the impacts are kind of yet to be seen. So that happened 2.5 years ago. You are seeing the market soften a bit. In Brooklyn in particular, there's a lot of zoning around a single family, which makes it kind of unique in relation to the other boroughs, also known as counties, actually. But you could look to that. So I know that inclusionary zoning was one. Two, there was some rezoning of some particular neighborhoods, and I just know because I just worked on one of those communities. To think about, the needs of, they were high needs areas. There was also a mix of low income, middle income, all the things that I'm hearing you talk about. And they're still finally trying to figure out, they attach some neighborhood plans onto their inclusionary zoning measure as well. So you've got some neighborhoods with special plans in order to think about those subpopulations. I'd be happy to connect you with folks there if you think that would be helpful.
well, with that, it is 5:01. I know we have places to be and things to do the rest of the evening. Let's thank our moderator and our entire panel and our audience for sticking around with us for the whole time.